Welcome to Module 3 of Vitamin A Deficiency, Worms, and COVID-19. Are you ready? In Module 3, you will learn about planning for vitamin A supplementation and deworming during the COVID-19 pandemic, and ensuring infection prevention and control measures during vitamin A supplementation and deworming delivery. Before you plan for a distribution event, always check with your local government authorities whether outreach activities can be conducted in your area. Make sure to coordinate with local government health officials and community health workers while planning a distribution. How can vitamin A supplementation and deworming be safely conducted? There are two sections in Module 3. 3.1 discusses infection prevention, and 3.2 discusses site selection to prevent the spread of infection in the community. Let us first look at the infection prevention practices for service providers during vitamin A and deworming distribution. In Module 2, we learned about infection prevention practices to be followed to prevent the spread of COVID-19. We will now look at the same practices, but from the service provider's point of view while conducting the distribution. Let us start with hand hygiene practices to be followed by the service provider. It is recommended to have a separate hand washing station for the service provider. Service providers must wash their hands before the distribution. To prevent the spread of infection between children, make sure that you clean your hands before dosing a child with vitamin A or deworming. Wearing gloves is not required as the virus does not enter the body through the skin. When you wear gloves, you can still pick up the COVID-19 virus, and it is possible that these contaminated gloves will infect others or yourself. Hand washing with soap and water will protect you more than wearing gloves. Use sanitizer if soap and water are not available. Use clean scissors for cutting the tip of the vitamin A capsule, and use white paper for crushing the albendazole tablet. Wipe off the excess oil on the scissors with a clean tissue or towel. Used capsules and papers used for crushing albendazole should be disposed of in a trash can immediately. The service provider will not touch the child to prevent the spread of infection between children. Guide the caregiver to position the child by supporting the child's head and keeping the child's mouth open. Ensure that the child is calm to prevent choking. Do not touch your face. Our hands touch many objects and surfaces which can be infected, so remember to avoid touching your eyes, nose, and mouth with your hands to prevent the virus from entering your body. Now let us look at respiratory hygiene. Service providers must wear medical or surgical masks throughout the duration of the distribution. Medical masks offer better protection compared to cloth masks. In addition to a medical mask, service providers should also wear a face shield. The caregiver and children older than 2 years old should also wear a mask and a face shield. Human saliva or spit contains the virus, so remember to cough or sneeze into the bend of your elbow and do not spit at the distribution site. The third infection prevention practice is to ensure physical distancing. While dosing the child with vitamin A and deworming, the service provider should keep a safe distance from the mother and child. Ask the mother and child to come to the table only at the time of dosing and leave immediately after dosing. Assign one volunteer or team member to ensure that people keep a safe distance of 6 feet between themselves in the waiting area at the distribution site. An easier way is to mark circles or squares in the waiting area at a distance of 6 feet. Minimize waiting time of beneficiaries at the distribution site, and also ensure that they leave the premises immediately after dosing. Allot time slots in advance to prevent crowding. Only 4 to 5 beneficiaries should be in the waiting area at any given time. Good teamwork will help reduce the waiting time of your beneficiaries. In summary, always check with your local government authorities and follow distribution guidelines. Wash your hands before starting the distribution and before dosing every child. Wear medical masks and face shields throughout the distribution, and avoid touching your mask, eyes, nose, or mouth or any other objects at the site. Maintain a sufficient distance between the beneficiaries and allot time slots to prevent crowding.